Why are so many healthcare workers experiencing burnout?
Because of all the things I had said previously. If you take things personal, if you feel that you should be getting rich from working in healthcare, but also, the violence towards healthcare has exponentially increased. People have somehow, somewhere become so entitled that, they demand, especially like in emergency departments across the country, their demands for things is sometimes very unrealistic. And then the explosion of mental health crisis and treatment. And, we have a lot of emotionally, mentally unwell people. I feel more so now than I can ever recall. And
from a health standpoint, where and how? Where and how, from a health standpoint, where and how do you see people mentally that are in
there's
that
just
crisis?
so much more. There are, how do I say this? There are more patients with emotional mental health diagnoses than I ever recall. I feel addiction has a lot to do with that. I think that it may be the precursor of a lot of instability. But, social media has a lot to do with it too. I think our children aren't developing coping mechanisms real well because they are in the age of the internet, of, access, information access, instant gratification. There's a lot to be said about that as well. I mean, that's a whole nother rabbit hole we could go down, which I'm sure we don't have time for. I feel like the family unit has been broken a long time.
Yeah.
And unfortunately, audiovisual devices have been used far more for babysitters than probably should be. But I'm not dogging any parents that, I'm not. You do what you got to do, how you have to. I get that. But I feel social media has taken away from us learning how to adapt and how to cope appropriately. And I feel like it has taken away the art of socializing.
Yeah. It's like it's a multitude of little things that is what's caused a lot of mental instability.
Yes.
With most of society.
Yes.
Addiction or no addiction.
Yes.
It both has the effect.